gentlemen, ladies and gentlemen, ladies and gentlemen. Welcome to Chat Room with Max. This week's edition. Oh my God, today is going to be very, very interesting. You're going to really learn a lot. I want to thank you all very much for being such a loyal family member, online family member. Thank you very much. Chatroom has come a long way. We talk about different issues. Today, we'll be talking about a major hot topic, and the topic for today's discussion is childhood trauma and depression. Childhood trauma and depression. Yes, that's what we're going to be talking about today. And we're going to, if you know someone that has been traumatized in the past that you know of, or you know someone who is going through depression, I would advise that you share this video with them so they watch and they're able to learn from what we're going to talk about, because we are doing our best to make sure that we help as many people as we can. So if you're watching this live right now, please be so kind to type and let us know where you're watching from. And if you're watching this after the show, please just let us just put a comment there and say thank you very much for what you do, and we will be sure to appreciate you. Okay. We have Timmy Tokwa in the house. She says hi. Welcome to the show, Timmy. So yes, we're just gonna dive right into the show, and we're gonna begin our conversations. Before I do that, I would want to introduce our special guests to you. These are people that have done great and perfect for the past 3 weeks now. They've been here with us live in chat room. Thank you for liking on Facebook. Thank you for liking on YouTube, and thank you for subscribing. I see all those things kicking in. So yes, guest number one, she was with us on day one of this mental health series. She has been exquisitely wonderful. She has been doing great. In fact, we have no, see, I don't even have the words to even thank her much with. Ladies and gentlemen, please make welcome the one, the only, Aminat, ladies and gentlemen. Welcome to chat room, Aminat.
Thank you for having me again.
Been, Aminat?
I've been good. How have you been?
Yes. I've been good too. Thank you very much for joining the show. You listened to us and you came back to shed more light on the topics we're going to be talking about today, which will be childhood trauma and depression. Thank you very much for coming on. Ladies and gentlemen, the next person that I'm about to introduce to you is the one and only therapist that in fact, she came in last week Sunday and she did justice to the topic of anxiety. Also, she was heading somewhere that we had to cut short last week. I'm sure she's going to shed more light on that. So please join me, make welcome the one, the only Alice, ladies and gentlemen. Hi, Alice.
Hi. Thank you for having me again.
Welcome to chat room. So we hope we are expectant today to learn a lot from you also. All right. So yes. Next, ladies and gentlemen, I'm going to be bringing in. He needs no introduction. The show is Stanley, and Stanley is the show. Ladies and gentlemen, make welcome the one, the only Stanley. Ladies and gentlemen.
Hey everybody, how are you? How is everybody doing?
Welcome, Stanley. Welcome to the show. Yes. So if you're watching online right now, please type your comment on the comment section. Let us know where we're watching us from. First of all, let's know who you are, and then let's know where you're watching us from so that we can say hi to you. Okay, we're not going to tax you, we'll just say hi to you. All right. Okay, so let's take some comments real quick. We have Rachel. She says welcome, Aminat. Rachel also says welcome, Alice. Thank you very much, Rachel, for the warm welcome. All right. So guys, topic for today, very, very touching. In fact, when some people saw the topic, they were like, oh, can I come online and say my story? Because they were really, really I think this is something that has that has hit a lot of people and affected a lot of people in so many ways, and we're going to be talking about that. So let me state the topic again, so our viewers watching from home will know exactly what we're talking about. The topic for today's show is childhood trauma and depression. Childhood trauma and depression. So again, like I said at the beginning, if you know a friend, if you know a friend or have a friend that has experienced one form of childhood trauma or the other, please and please share this video with them. And if you know a friend who is depressed, please and please share the video with them, because they're going to learn a lot. Okay. So, ladies in the house, welcome once again. Let's begin immediately. So, let's start with depression. Let's start with depression. What do we understand? What do we understand depression as? What do we think depression is, and how can people know what depression is? Who wants to take the first stab?
Who has the clinical? Who has the clinical book? I want to do the clinical explanation. If since we're regular
Okay,
people, like
Alice,
just talking
Alice.
Okay.
because
So when
we can talk. We can explain it clinically, and we can just
yeah,
explain it how a normal person, a
Mhm,
regular everyday person, will address it and things like that.
mhm, mhm,
yeah. So it's a word that we often you will hear a lot. People will say I'm depressed, and often when people say that, it majority of the time it means they are sad. They are not like clinically depressed, but it's like they are sad. Oh, my husband didn't call me today, so I'm depressed. Or I didn't eat breakfast today, so I'm depressed. Or I missed my bus today, so I'm depressed. So that's like the basic everyday language that we use. But
yes.
in terms of the clinical terms, when we talk about clinical depression,
Mhm,
depression is like an umbrella term, like we talked about anxiety. It's an umbrella term for different kinds of depression that people experience. So the major one would be major depression, depressive disorder. There is PMDD, that is premenstrual depression,
postpartum.
uh, dysphoric something. There is erratic mood, dysregulated mood. There is depression related to maybe substances, alcohol, depression related to medical issues, depression related to, let's say, life issues, and all of those things. So
Mhm,
when we talk about depression, clinically, we are talking about um, sadness. So you have to be sad. Feelings of worthlessness. So feeling like you don't have any worth. All of that hopelessness. So feeling like there is no hope for you, the future, and all of those things. And there is also like the physical aspect of it, where um, you feel exhausted and you feel tired. Some people would even say that their body aches, that they have body aches, muscle aches. They cannot um, even get up. It's not that they are lazy, but physically they feel this sense of exhaustion, fatigue, that they cannot get up. So there is that aspect of it as well. Irritability. So the smallest thing would irritate that person, or it would set them off. And then we have the extreme part of it, which is the person may have suicidal ideation or suicidal thoughts. So that is thought of killing themselves, not wanting to be alive, and all of those things. And then there is low appetite, not eating, hypoinsomnia, and then hyperinsomnia. So either they are sleeping or they are not sleeping. So each person and how it present. When we talk about Black people specifically, Black people and specifically Black women, depression often manifests as irritability, aggression. For men, especially for Black men, it's aggression. So you see this person, you feel like, oh, this person is too aggressive. Sometimes it is depression that manifests as that they are very angry. All of
mhm,
things, it could manifest as that. And then for a lot of Black people, it manifests somatically. So um, backache, headache, not feeling well. Somebody will say, my body, I don't really feel like myself. All of those things. And then there are people who have what we call high functioning depression. It's not a clinical term per se, but it is there's somebody who they are depressed, but they can perform. When you see them on the outside, you say that, oh, this person is not depressed, because they can go to work, they can do all of those things, but behind closed doors they are not really well, or they are going through depression. So that is the overview of depression. We can go into the details of it.
Okay, thank you very
And
much. Does anybody want to
just
add? Yeah.
to pull that all together, the idea of depression or what have you is typically a loss of interest in what you
Mm,
typically used to derive joy from, and it's and you're no longer able to engage in those activities or even function at your normal level. So you're whatever it is you used to do, you're unable to do it consistently, and now you're just like it's just impairing your daily life.
okay. So from what you guys are saying, I know there are some people that when they lose a family member or lose a loved one, or their boyfriend breaks up with them, or the economy is very, very hard, dollar has gone up, they complain and say they are depressed. They are depressed. Are
Mhm.
they right in saying that they are depressed? Is that part, or is that real depression, or is that normal?
It's a yes or
Well,
no.
it's a yes. They're entitled to have an emotion related to a breakup. They're entitled to have an emotion related to the fact that things have gotten a little bit more expensive.
Mhm.
Mhm.
Um, the issue would be when, instead of processing the breakup from the relationship in a healthy manner, they now want to engage in behaviors that are negative, or now that because the exchange rate or what have you, which is an everyday increase, has increased, and then maybe they're no longer able to afford food to feed their family member. So instead of saying,
Mm.
looking at strategies on how can I work with what I have, they're now unable to process that and now needing to disengage from that.
Mhm.
Wow. Wow. Okay. Okay.
So
Uh, you,
something.
you want to add something, Alice?
Yes.
Okay,
So
go ahead.
just like last week, we talked about anxiety, right?
Yeah.
Like all these things that you are talking about, it can be causes of depression. So we have the external causes and the internal causes as well. So we can say they are clinically depressed if it gets in their way of their daily functioning. So,
Mm.
of course, if somebody breaks up with you,
Hmm.
you can take a day or two, you cry, and
Only
you
a day or two.
Maybe five
I
days.
remember my ex cried for like 30 days and 30 nights. She even fasted. Now, okay. So, um,
you
sorry.
it
Okay,
becomes
hold on, guys. Let's know if you have questions for these professionals, because it's very, very important that you learn. Listen, we are bringing these people here so you can learn from them very, very well. Oh. All right, but before we continue, let's do what we always do. Let's like where we're watching this from. Let's subscribe to this channel. Let's hit the notification tab so you know just when we are on. And then lastly, don't forget to share, because
There's love is sharing. Sharing is caring. Caring is kind. Kind is good.
I know everybody was surprised to see him. Okay, fine, fine. Well, ladies and gentlemen, Sam Soft in the house. Welcome,
Yes,
sir.
yes. How y'all doing?
It's only Sam Soft that know how to make people depressed with his dressing.
I talked about that.
Yeah.
I said I'm coming here to, to traumatize you with my
Engineer,
outfit.
make the screen big, please.
Yeah, I'm here to traumatize you with the outfit. You know what I'm saying?
Only him
We
is
do
wearing.
it like that.
Only him is wearing barrette. Yo, there is God, though. We have to come to the show with uniform.
I need to wear my uniform one day.
You need to wear your uniform one day.
Yes,
All right, Oga Stanley, I see you. You haven't said anything yet. Do you want to add anything before I take
Stanley
some
Young,
comments?
like 20 years old. He had a haircut.
No, Stanley is just oppressing. He's trying to depress us with his
With his
beautiful
haircut.
house. No, his beautiful house. It's fine. It's fine.
There is God.
Yeah.
I had to change location for the lighting today.
You are looking so good, brother.
Yeah, you're looking
better.
good.
Yeah. Thank you.
Yeah.
Just getting nobody's call.
Okay, let's go ahead.
Oh no, I was gonna say I'm just getting over a cold. Sam and I have been talking through the week. But those are great points that they made. The only thing I want to add is an experience of low mental energy that could either be temporary or long term. The little question I wanted to throw to Alice.
Yes. Mm-hmm.
Well, what's is there a difference between anxiety and depression, or are they borderline or similar? If you speak on that a little bit.
Mm-hmm.
Go ahead, Alice.
Okay, so there is a difference between anxiety and depression. In the basic, if we are talking in terms of energy level, depression can be low energy, and then anxiety can be high energy. The other thing is anxiety is more often about future anticipating, so talking about thinking about the future, and depression can be termed as ruminating about the past events or things that may have happened in the past. Depression is related to, when we talk about chemicals, really related to serotonin, dopamine, like low, those kind of things. And then with anxiety, it's kind of more electricity or more firing in the brain and all of those things. So there are differences. However, in my clinical experience, what I've seen is that they often go together. They often go together, or oftentimes they come together. It's often difficult to say which one came first. Is it the depression or the anxiety? Or because some people may have depression and then they will be anxious about it because they are always thinking about it. Or this job that I'm going to look for, what if I get this job and then now I'm depressed and all of those things, and then as a result they will be withdrawing, not going out, and then depression will come in. So oftentimes it goes hand in hand. So another thing, just to piggyback, is really it's very, very important for all of us to get to know ourselves so that we would know our baseline, like Aminat talk about, so that you would know your baseline. My baseline may be different for somebody else's baseline. I am an introvert, so I am a very laid back and all of those things. So I am quiet and all of that. Versus somebody who we say is an extrovert and all of that. For them, if maybe they are quiet and laid back, then they know their baseline. So they could say, okay, maybe there is something going on here that I need to check out. So as humans, it is often very, very important for us to know our baseline.
So, Alice, what you're saying, in other hand, is some people might actually, when some people from outside, let's say like me and Samsof now, for example, Samsof will see me, I am calm, always calm. I don't like to go out. I like to be inside and all that. And then he might just end up saying, oh, Minister Mex is depressed because he doesn't like to go out, because he's calm, because he's too. So, but for me, that's my baseline. That's not technically depression. That's okay. So I hope you guys are learning from this. And also, okay, let's take some comments before we proceed. Okay, let's take some comments before we proceed. We have a comment from Mr. Eugene Okpala in the house. He says, hi chat room crew. We're watching from Jos, Nigeria. Best wishes and exciting
You're welcome, sir.
Thank you very much, sir. Healthy Jesse Chop says, good evening, happy people.
How are you, daughter?
Yeah. Rachel says, as professionals, would you say would you say you have seen more women than men dealing with depression? If so, why do you think women are more likely to deal with depressions? I will hold off. I will hold off on this question for now. Yeah, let's not talk about this right now, so we don't segue.
But don't forget
come back to it. Yes. Healthy Justice Club says, "Happy Sunday, everyone." She also says that depression comes in different ways. So for me, it's still depression. Well, okay, let's take this comment first of all. Let's deal with this comment first of all. So to the professionals in the house, to everybody in the house, would you say women are more susceptible to depression than men, or men are more prone to depression than women? And if you say yes, why? If you say no, why? Let's go.
So this is, there are many different factors to this, right? In my work, more women come to therapy than men. So we would say that based on that number, I can say more women get depression than men. However,
but you know what? Let me say something. Can I say something about that?
Please do.
I think men, even when they are depressed, because they have that manhood and personality.
I'm coming to that.
They don't want to share it.
Yes. However, more men die by suicide than women.
So when you say more men die by suicide,
so then they don't handle it well.
Do you mean that happens because they were depressed and they couldn't handle it anymore?
It could be a factor. They didn't reach out, right? Women are more socialized to be sociable than men. So for women, we would talk and talk and talk and talk and talk. And sometimes men would be like, why do you talk? But
men, are you listening?
Men, I hope are you listening? Hey, talk. You don't die of exactly. Better talk. Open your mouth.
Open your mouth and
talk. Okay. I mean, do you want to say something?
However, it's our way of processing things, right? So, for example, if let's say I went to work and something happened, maybe I'll tell Aminat, hey, this is what happened. And then she will say, she will back me up. And then the talking will go and go and go. Maybe an hour after the hour, I have released this, right?
Stress,
right?
That's very beautiful point.
Exactly, right? If let's say I am home and my partner is misbehaving, I will talk and talk. He may say I am nagging him, but I'm talking. Like, pick up the garbage, do this. But the men, maybe I would do something he doesn't like. He wouldn't even say it, or he will pretend he hasn't seen it, or all of those things. So all of those things are a factor when we look at it. And for women also, there is postpartum depression. There is we also get premenstrual dysphoric, also that comes with our monthly cycle and all of those. So our hormonal makeup also makes us more susceptible to depression, things that we don't have control over. That for some women, every month, either a day or two, they experience some form of depression or some form of mood change. And then for some women, after having children, or even during their pregnancy, they may experience depression and all of those things. So that our genetic makeup and all of those things makes it different. But more women seek help than men, and then more men die by suicide than women. And then for men, depression often comes out with aggression. And then when we look at suicide and the method of suicide, men use aggressive methods of suicide than women as well. So for a man, when they attempt, they are likely going to die at the attempt, because it's very an aggressive way of doing it, versus maybe women may not use aggressive methods.
All right, let me step in here real quick. If you're watching right now from wherever you're watching all around the world, what are you doing? Have you shared this video yet? You're just watching, enjoying it, and just watching. You're not sharing.
It's a very important topic.
It's very, very important. I'm very, very sure.
You can save your life right now by sharing it.
Yes. If you count 10 people in your life, there will be like 2 to 5 that would either be depressed or would have experienced childhood trauma. So why are you keeping this information to yourself? Where you begin to share, share.
There's love in sharing. And when you share, you will not be depressed. Because when you are sharing, you're active, because activity can keep you away from depression.
Let's take some comments. Okay. Healthy Jesse Chop says women are more depressed than men because we are emotional beings. Everybody is emotional.
Yeah, I think this thing we need to stop saying it. We are all emotional.
Everybody is emotional. I've seen men that cry more than a woman.
I'm telling you.
Please. We have Dupe in the house, everybody. Dupe says, do expand more on suicide and depression. Hopelessness, in my understanding, is a key reason for suicide in the black community, at least Nigeria. Yes, we'll definitely talk about suicide. That's a different topic on its own. We'll talk about suicide. We'll talk about postpartum depression, which obviously is a silent killer that a lot of light is not being shone on. So we'll talk about that. And of course, people know what I'm going to do at the end of the show already. Those that know already. I mean, what do you have to add? What do you have to add so far?
I think we're touching on really strong topics. Same thing, like I always say, I think just going back to what Addis had touched about, and I think you try to bring it up as well, the idea of, what depression looks like, how you can be functioning but still be depressed. I think the language was high functioning. I think those are those individuals who are depressed and high functioning. It's I almost want to say it's like a slippery slope, because their intent of harm might be quite deep. But you see them, but I just saw them the other day. They look so good. They look so well. But
exactly,
because they're high functioning and they're in that, I believe, depressed, they might have a plan, that maybe like to end their life or whatnot. But those people, if you're listening anywherever you are, I think it's important to speak out. Like we talked about how women, we talk. So, the talking is therapeutic because we're releasing and we're hopefully having somebody else to back up our wrongdoing or our right doing, what have you. But if you're in that category where you're high functioning, but that there's something wrong with you and you're planning and you're having multiple negative thoughts, seeking help, I think should be paramount.
So now, when you are seeking help too, be careful who you seek help from, because you don't want to go to the people you talk about it and then you get worse.
Alice is laughing. She already.
Yes, you don't go to the wrong place.
Okay. So let's keep this moving, right, before we jump to the next issue of the day. Now, from my understanding, me, I don't know much about all these psych things like that. From my understanding, I was meant to understand that when there are some certain things that are normal when someone who loses something is going through, that they should go through automatically, normal. And I think they said it was I think they used the acronym DABDA. Yeah, 5 stages of. The 5 stages of grief.
Grief.
Which proves that depression is kind of normal at some point. When you lose something,
when something actually happened,
when something tragic happens, or something bad happens, depression is a normal thing at that point. It's when you are not able to control it or get out of it that it now becomes a problem. That's what I learned that he told me the other day.
It can develop to mental.
Yes, of course. And with the question about depression going side by side with anxiety, sometimes that could be the case in some cases, but they are very, very different. I think it was Stanley that asked that question. Actually, they are very, very different. Anxiety is like the inverse of depression. where anxiety is this, depression is this, anxiety is this, so like that, pretty much. And of course, that's how you get to know your bipolar disorders and all that, which we're not talking about today. But please, and please, my people, my question for you now is this: what would you advise a person to do that has been depressed for quite a while? What would you advise them to do? How would you advise them to go about dealing or seeking help with that depression that they're experiencing? I will take the comments very soon, but let's just answer this question. Yes.
You know where I'm gonna go with this.
Yes, I do.
So, if you have depression, especially my African brothers and sisters, do not. You can go to your pastor, but
Not too,
change that today.
but here is it: if you have depression, it's not the time for you to be fasting and praying and not sleeping, because we have something called depression with psychosis and hallucination. So if you have depression and you are intentionally not eating, or you are fasting for 40 days, you are not sleeping because you are praying at night and all of that, now you are going to add psychosis to your depression. And you will be seeing things and hearing things and all of those things. And now you have made the issue more complex than it should.
But my question for that one, it does not depend on the kind of depression the person is having.
Well, that's why there are some certain things you are not supposed to do, so you don't induce psychosis. Alice, can you please tell them what psychosis is? So, and Aminat, please, if you, because I believe some people might just hear something and they say, "Oh, God is talking to me."
Another level at the altar, so.
Okay, go ahead, please.
Psychosis, in the basic term, is a break from reality, right? So, right now, we know that where I am, it's Sunday, it's 4:44 p.m. I am in Ohio, right? A person with maybe psychosis may not be aware of these things, or their reality may be different from your reality. So in the basis, that's what it is. And then we have hallucinations and delusions. Religious hallucinations and delusions is one of the most common forms of psychosis. So
can you please give us example of religious hallucination and delusion?
So I beg you, if you're a man of God here, I beg you.
Stanley, am I seeing things, or is somebody actually at your background?
Are you assimilating?
No, I can't hear you. What did you say?
Somebody there. There's somebody.
Yeah, that's
okay. So I'm not just
that's
seeing.
still what you were seeing.
You didn't see the person at your background.
There was somebody there.
That's a baby there.
That's my niece.
Okay, let's keep going. Sorry about that.
Religious hallucination. I talked to God. I had breakfast with Jesus. Jesus told me to tell you to.
Hey.
I was touched by God.
You're what? I was what?
Touched by God.
Okay.
Right. So those are, because hallucination, it goes with the senses. So our 5 senses.
Yes.
Either you touch, hear, smell, feel, taste, all of those things. Right.
Okay. I'm trying.
So are you trying to say that
Sam soft? Don't push it. Don't push it. We actually have a topic scheduled for March 10th, and March 10th we'll be talking about mental illness amongst clergymen.
Mhm.
March 10. Yeah, so let's not overflow. Let's not because that's a very, very interesting part to go to. Before you know it, now people start going
Not be you
buzz
go ask her the question.
buzz on the comment section. Okay, now let's take these comments, please.
He doesn't comment.
Okay. So we have Ken Rollins in the house. Wow,
Oh,
been a
Ken
while,
Rollins.
Ken.
Oh,
He says,
yeah.
"I help. Help you. They carry me go where I don't know." LOL, so yeah. We have Rachel. Rachel says, does untreated depression always lead to SI, or would you say SI and actual attempt can still happen even with those who are being treated regardless? Okay. Let me read it again. It says, does untreated depression always lead to SI? Or would you say SI and actual attempt can still happen even with those who are being treated regardless?
Okay.
Well, let me jump on this for starters. Then Aminat and anybody else can jump on it. This is what I know, right? Does untreated depression always lead to SI? No, it doesn't always lead. There's nothing that is absolute. Nothing that is absolute. Okay, it's personal based on the individual. And
for the sake of the audience, can you tell us what SI is?
oh, sorry, SI is suicidal ideation, or pretty much, I believe, insinuating
good point,
suicide. Yes, that's
Stanley.
a good question, by the way.
Yep.
SI is suicidal ideation. So no, it doesn't always. It depends on the individual. And number two, there are some times when a patient is depressed. You want to be careful of what you prescribe and how fast you get them out of that depression, because at that point, that depression might actually be what is keeping them, alive. Because when you now go and treat,
and they
become energetic. They carry out that plan. So you want to watch. So no, people. Now the second part of our question is, would you say SI and actual attempt can still happen even within those that have been treated regardless? Yes, it could still happen regardless of treatment. In fact, sometimes some people might, use the medication that they're being treated with to, attempt and all that. So that's what I understand by it. Please, guys, do you guys want to?
I think you're on track. I think you're on track with that response. Obviously, when you're being treated for for your mood, and because with depression, you sort of lack energy. In cases, you're able to able to follow through if you're not high functioning with certain things. But once you start to feel better, now those ruminating thoughts and things like that, you're like, oh, I can do this or do that now because you now have the energy. That's where it becomes, tricky because hopefully you're being followed by somebody. That's when they now tell you to watch out for behaviors like if they're a little bit too happy, if they're now saying, oh, giving away their belongings, oh, you can have this, you can have this. Don't be so quick to take their belongings from them. Question,
Mhm.
why are you giving it to me? Why are you
Mm.
giving me this thing that you like and things like that? They're not being generous to you. They're releasing something because they feel like they might not need it. So that's where you have to be cautious and realize that what is the reason behind this generosity.
Mm. So are you trying to tell me that sometimes when these medications that they prescribe to them to block their mind, or does it block their mind from doing what they're taking their personality, like their normal way of thinking? So because like with what I'm hearing is like the medication will make them forget what they are planning, meaning that when they are planning something, are they in that part, at that part of their life, they're normal at that part, and then the medication makes them normal because it blocks them up from thinking
They're
and planning.
normal. They're
Mhm.
always
Always.
normal.
Mhm.
Because I have a
That's what.
diagnosis of depression or anxiety, doesn't take away from the fact that I'm a normal and fantastic
Mhm.
and great and
Mhm.
achieving and I deserve to be a live human being. I think, and I think what I was hopefully trying to say without steering people in the wrong direction is
Mhm.
when if I'm tired, right, on a regular basis, right? If you're tired, you don't have energy to do certain things. Even though I have been thinking about, oh, I want to do it, I want to do it. What I want to do this, I want to, it could be something good, it becomes something bad. But if I'm tired, I really do not have the mental energy. I really do not have the physical energy to do it. But
Mm,
maybe when I now engage in certain skills or in certain medication management that can
mm,
support my motivation, make me a little bit better, I'm like, okay, I'm no longer tired. But what I was thinking about the other day, okay, maybe it's now time to carry it out. Maybe it's now
Okay.
time to go to the gym. Maybe it's
yeah.
now time to do something negative.
Hmm.
Okay.
That's what I was trying to get across.
Yeah, thank you very
Thank you
much.
so much.
Let's quickly breeze through the rest of the comments and then we continue. We have Solomon Ojima Onalu in the house.
Hey,
Welcome,
what's up,
welcome.
brother?
Yeah, he says, hi. Many societies, in many societies, there's stigma around men experiencing a vulnerability or seeking help for mental health issues. How can we break down these barriers and create more supportive environment for men?
Mm.
Well, this
This is
is
this
one of
forum.
it.
This is one of it. Yep.
Yes, this is one of it. Exposure, talking about it,
And sharing
sharing it, saying it's okay to feel down. It's okay to cry. It's okay to talk about
It's
whatever you're
normal.
going through. It's normal. Not be only women they talk. We self,
Talk,
let us
oh,
talk. Let us talk, okay? Because as you had Alice at the beginning,
speak out.
women like to speak out and talk. Men were, were men. We
Yeah.
bottle everything here. Strong man,
And it's not
strong
even
man.
healthy
It's
to
not
bottle
healthy.
everything.
Yeah, please speak out, talk, seek help, okay? It's very, very important. We had next comment from Dupe. She says, a question. Why is there a greater predominance of suicide in one gender? I refer to what I know of in Nigeria. Why? Who wants to take this one? I know I was avoiding this particular side of the topic, but let's just briefly answer that question. Who wants to answer this?
What gender is she referring to? If she could say, please.
Well, it's obvious.
We talked about it already.
No, I
Yeah.
wanted to hear from her.
Women.
Nigeria. She mentioned Nigeria.
Yeah. Okay. So let Dupe answer that question and then we'll piggyback to that. Rachel says, how often do you see patients who get well, get off meds, seem to be doing very well for a while, and then boom, they return again after some time?
Relapse.
Chances of recurrence. So she's pretty much yeah. Alice, you
But
want to take it?
depression, yeah. So when it comes, life goes on, right? Life is still happening. Tragedies happen. There are ups and downs in life. Breakup, you lose a job, you lose a parent. So all of those things are still happening. So the fact that, let's say, you get medication or you are in therapy doesn't mean that these things are not going to happen and they are not going to bother you. So they are going to bother you. And then we talk about the biological aspect of it. There is a severe form of depression, and maybe Amnat could talk more about it, called chronic depression or treatment resistant depression.
Mm-hmm.
That is depression that cannot, no amount of medication and all of those things can cure it, or can manage it even. So with that person, it's often they come to an acceptance that they are going to live with this for the rest of their life, or there are extreme ways, the shock that they give to your brain, that is
ECT,
very,
TMS, all
yeah,
those things. Yeah. Mhm.
that is very intense, and not all doctors
Recommended.
recommend it because it can lead to memory loss and issues with memory. So, when we talk about depression and mental health issues, we have to know that as humans, as we are going through life, things are going to happen. Do you have the tools to deal with them as they happen? It's okay to be sad when you lose somebody in your life. It's okay to be sad when you lose a job, but do you have what it takes to deal with it? And sometimes there are times that your coping skills may not be enough. So you may need medication for for a month or two to carry you through that time, and then you could stop and then you could go on. So again, we have to be resilient and roll with the punches as they come. That's what.
Okay. So real quick,
can I share my testimony based on that? When I lost my wife, I was depressed. But speaking of speaking to the men, when we have that kind of ego, like, okay, I'm not depressed, I'm soft, how can I be depressed? Yes, I was depressed because it's somebody special to me. And when I started feeling that, I was feeling lazy. I'm very hyper guy.
Low
you
energy.
can tell, low energy. I was not excited about anything. The house was ugly to me now. Beautiful house before. The cars looked terrible. Everything was looking upside down. And I stayed in a spot for like 3 days. I didn't move. That's when I knew there was a problem. And then immediately I said, I need to get out of this position and get myself back together. I have to wave it off, and I started, calling people because at first I was keeping it. I just keep my thought with me. It's affecting me. When I started calling people, when I started crying out, when I mean crying out, I mean when I call you, you hear me cry because I couldn't hold it. I was crying because before I was trying to suppress it, like, don't make me. But I started crying, talking about it. Just, the pain was leaving gradually. So that's why I want to say to people, like, if you have to cry to feel better, don't hold it back, cry. There was a pastor that came to my house that other time.
I remember that pastor.
And the pastor said, "Why are you crying?"
You're a man.
The pastor hear for my hand that day. Immediately, the girl said, I rebuked him quickly.
Yeah.
I told him, you know what? It's my cry. Is it your cry?
And I shouted, Amen.
Amen. I have to cry. I wept and I felt better. He apologized.
Even Jesus in the Bible
He wept. And I'm friend, I die. You'll not be a wife. My own wife, you cannot cry. Where they worry you? Now you cry. So after I let that pain come out, and I was talking to people. Anytime I feel, because it doesn't go away, whenever it comes back, you have to call somebody, call people, get people around you. That's why it's always good to have people around you when you're going through. Yeah. Like we talk about, you speaking out is very important. And it helped me, and I feel better. And, you need your mind for the new wife that will come, because you don't have to lose your mind. Because if you lose your mind, you don't have to have it again.
But still, don't be stressing your friends that you have around you. Sapsov used me to play basketball that time. play basketball every Saturday.
Your waist,
my waist. Come and see us breathing like old men.
That basketball game.
So what's that basketball again? But yeah, so pretty much with what Sapsov said, yes. Be you a man, a woman, depression is real.
It's very real, brother.
You go through it. And please, I just want to add this. If you feel you've been depressed for something happened, you've been depressed for a prolonged period of time, like from 2 weeks and above, please seek professional help. If you feel depressed and some intrusive thoughts are beginning to come in, please seek help, because that's very serious. Very important. Let's keep going with the comments, please. We are supposed to talk about childhood depression today.
Childhood
trauma.
Thank you. We must talk about it. If not, they will have to come back.
And because I have something to talk about that one.
How they plug in.
You're done with depression, right?
Let's just take this comment real quick. Rachel says, does it ever go away completely?
I think I answered that with the first.
So talking about treatments, actually, Alice made mention of treatment resistant depression. Good news, science is coming up with different ways to help out, and there's one right now that I actually had a patient who went through it, and she was like, wow, I feel very good. If you see, very excited, very happy. That's because it's called TMS, where they focus on just the part of your brain that is like that part that is low on that particular this thing, and then it just transmits some some shock. You will not feel it that much. We're not talking of TMS today, we'll talk about it later. But yes, science has brought up different options. Nelson says, good evening, lovely people.
Hey,
Deborah is in the house. She says, hello chat room. Do all types of depression require the use of medication? Do all types of depression require the use of medication? No, it doesn't. Alice, you want to share Aminat? Let's hear from Aminat, then we hear from Alice.
Not necessarily.
Yeah.
Just like what Samsov said, like he realized that he was in a depressive state, and his therapy was his solution at the time was re-engaging back to people who could support him as he processed his processes lost, which helped
Mm,
his mood. So to answer Deborah's question, no, there are other supportive ways that you could help to
yeah,
elevate your mood that
yeah,
do not require medication till it does.
Yeah.
yeah. Very true. Very true. So, Alice, you want to share those supportive mood, those supportive ways?
Yes. So if you are somebody who struggles with depression, right, you are going to feel like you don't want to do some things. You
Mm.
have to do the things that you don't want to do.
Mm.
So here is the thing, have a morning routine, right?
Mm.
Get up, take a shower. Even if you
Mm.
feel like you don't want to scrub
Holy
yourself
shit,
with a
yes.
sponge, just get in the shower, let the water wash over you.
The water is
Change the
powerful.
clothes, right? Change the clothes from the one you went to bed with to a new one. Eat something, whether it's an orange, whatever it is, eat something. So that's your morning routine.
Mm,
It's there. And you will see that there is something called behavior activation. Once you are able to do one thing, you would have the energy to do the next thing, and then you
Mm.
can go for a walk and all of those things. Now, you can dedicate an hour to your morning routine, and then when you finish doing it and you still feel like you want to go back to bed, go back to get bed. But in that way, you've already taken a shower, you've eaten, you've done about 10 minutes walk, all of those things. We talk about calling somebody and talking to them. Very important, right? When you call a friend, you don't have to tell them I'm depressed. You just have to, oh, I just need somebody to talk to. How are you doing?
Mm-hmm.
Get somebody's voice, all of those things that helps. The other thing is therapy is very, very important. If you feel like you've tried all of your coping skills and
And it's
it's
not working.
go to therapy, talk to
Mm-hmm.
somebody,
mm,
listen, let them listen to you so that they can help you process it. Because sometimes we are caught in a loop of negative self talk that when it is only in our head, we think we
mm,
are worthless, life has no meaning, and all of those things. But when you have somebody there and they ask you questions and all of that, they will be able to bring you a different perspective to tell you that, okay, yes, maybe the situation is hopeless now, or you have choices. How can you maneuver this situation? It's okay. You've lost somebody. It's okay to cry. Life can still go on. You now have to find a way to live your life without this person and all of those things. So they are going to help you. And often I say medication should be the last resort if that's what you want. If you feel like, okay, I've tried these things and I need medication, all of those things. And yes, I talked about um, church and all of that. For some people, praying helps. But like I said, you can pray, but do not take away food and sleep from you because it can also bring up new things. But as you are sleeping, you can pray, you
mm.
can read the Bible. The Lord is my shepherd. Even though I walk through the valley of shadow of death, I will fear no evil. You may
So,
be walking through a
Positive
dark time.
mm-hmm.
affirmations.
Yeah, you may be walking through a dark time. So it's good for you to know you are not walking alone. God is
Yes.
side. Whatever it is, you are going to overcome it. Before you were
Even as
born, He
Alice,
knew
even as
you.
Alice go church today.
Yeah. Yes.
Last week she didn't go to church.
No.
That's why she said last week she said, "Oh, don't go to your man of God, oh."
Yes. Now the
But
word
now,
of
now
God
the
is
word of God
inscripted.
has, yeah, she's even quoting
It's
the Bible.
inscripted.
Amen.
You are fearfully and wonderfully made. If you feel like
Preach now.
you're worthless, you know. Before even you were born, God knew you. He formed you. He know the number of hairs on your.
Oh yeah, you don't do it has do. We know. We know you went to church today.
So
Let's
that you know that life has meaning for you and there is
yeah,
purpose for you. So take a holistic approach. But like I said, this is not the time for you to fast and pray. You can put the fasting and praying aside when you feel better. You can do it, but
yeah,
right now it's not the time. You want to take care of yourself and get into a better health.
yeah. But there's one thing I want to add, right? And a lot of people don't actually recognize this. Knowing and understanding yourself is key. Knowing and understanding yourself is key. Know yourself to the point that when things are about to go off, you know just what to do to draw you back to reality. For me, when things are going crazy and I feel down, my number one thing I do, I'll just turn on comedy and just be watching comedy and be laughing up and down. I will laugh, 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 and then before you know it, I will come out and begin to talk. And then I give myself time to forget about what's going on, forget about everything, and then revisit and deal with that particular issue. So you have to understand yourself. It's very, very important.
Form of distraction.
Yes, exactly. So Dupe says, we all know the gender, but a psych nurse still but a psych nurse sitting right by my side believes that without scientific data, one should be careful to generalize. Well, people
I
should
think
talk. People should talk.
statistics shows. I don't know if she's referring back to the comment about who
Suicide.
commits
Yes, with the gender that, yeah.
I think statistics already show that men
Yeah.
do complete women might attempt more than men, but men are more successful because they use more
More aggressive.
lethal
Yeah.
lethal ways. Like a woman would think of things like, oh, who's going to clean up afterwards? So her ways
Yeah.
might be a little bit more gentle.
Yeah.
That's why they're not as successful in the act. But because they're thinking of who's going to clean up, who's going to find me, things like that. They're still being intentional about the person coming behind them as opposed to a guy, a male.
Very true.
The reason I asked to clarify the gender in that comment is the mention of Nigeria. That's a big factor in it. Stats that is going on right now, from the reports that we've gotten so far,
Yeah.
it feels like it spreads across both gender, and the female is picking up real fast as it is. And from what we're hearing in the news of how they go about this process is very drastic. And in many cases, you really can't even speak about it in the open. Generally, if you look at the world, maybe yes, the stats that's being gathered directed more to the male gender as being those that are more that pull through with their plan and act of wanting to commit suicide. However, the Nigerian situation right now, we all know the circumstances and how much pressure it puts on the people, and the male gender seems to respond mainly to it depressively because of the responsibilities that they carry. So there's so much on them that when the energy is low, hope is lost, they consider just about anything in front of them. And if they can't pull through with their thoughts and they lose control of their thoughts, then the inevitable becomes a reality.
All right. Thank you very much for that explanation. Temitope says, thank you guys for your wealth of knowledge. This is a great enlightenment for our people. Yes, it is. Thank you. She furthermore says, I'm soft. Sorry about your loss. May the Lord continue to strengthen you.
Oh, thank you very much.
And please do not stress Minister Max with basketball.
I just start.
She know that one. I mean, just that. He said to the job. Jessica says, yes, it's very important knowing who you are and being able to understand that some certain things did not complete. Dukwe says, I responded that cultures are different and likely account for a higher number in one gender. Yes. She furthermore says, we should be careful. TOS.
TOS, what is TOS?
Please, what's TOS?
Don't come and put us on depression with that TOS.
Ladies and gentlemen, it has happened again.
Hey.
It has happened again.
What has happened?
It has happened again. What has happened
the
again?
Time.
It has happened again. What has happened again is we were supposed to talk about childhood trauma and depression.
We just focused on the depression.
We had to talk about depression because it needed the time that it was supposed to take.
Mm-hmm.
You understand? Yes. So I don't feel bad that we talked about just depression today. Jacinta says, if you experience childhood trauma, that doesn't necessarily mean you will develop adult depression. It's a question, but it's a statement, but she's putting question mark at the end. So I believe she's asking a question. So if you experience childhood trauma, does that necessarily means you will develop depression as an adult? That's a question she asked. Next, comment from Deborah Okbala. She says, "Good evening, chat room. Speaking on childhood trauma, how can you assess a person to know if he or she has a childhood trauma that hasn't been dealt with?" There are different ways. I'm just going to answer this one shabbily now because I don't want us to touch it today. We don't have time. It's exactly 1 hour right now, and our special, beautiful guests.
Somebody have a birthday? Something?
No, everybody. Why we? Yeah, let's. So please, ladies. Can we talk about childhood trauma next week?
Yes.
I mean, at the beginning of the show.
It's a great topic.
Yeah, at the beginning of the show, I mean, that was like, I hope you're not going to tell me to come back again next week. We better talk about everything.
I did remind you that May, actually, seriousness, is Mental Health Awareness Month.
Yes.
So the whole month of May is dedicated to each and every one of us,
There you go.
and making sure that we each support our mental health. And yet different, depending on what part of the country or that is this part of the world. I believe in the US, it is Mental Health Awareness Month, and there are different things that people are doing to bring awareness to people's plight for mental wellness.
Yes. So please, I would want us to reconvene next week, please, so that we can talk about childhood trauma. Please, can we reconvene next week so we can talk about childhood trauma? Thank you very much, Alice. Aminat.
Okay.
Thank you very much, Aminat.
Aminat, good job, though. Coming.
Yes, Stanley, obviously. Now, we.
You not get choice.
We'll just find better. We'll just keep getting light.
And I like your background. Your background at war.
Yeah. So, ladies and gentlemen, we have come to the end of this wonderful. Okay, let's just take this one last comment. Let's take this comment. When you see a patient who is ill, how do you determine whether that illness caused their depression, or if their depression is the case of the illness? Same thing. Yeah. It's the same question, even if you turn it around. It's the same thing. So how do you know if that illness caused their depression, or if their depression is a cause of the illness? How do you know?
I think for each patient, obviously, that's where you get information from. So when you first meet a patient, a client, what have you, you're having a conversation, you're having history of presenting illness, you're asking them personal questions, and from there, if there's a medical illness, you address that. And and hopefully if that resolves, then obviously their mood could resolve and whatnot, because it's just like going to a hospital or going to hospital and you have different concerns. They have 5 different people. The provider there will triage them based on the level of severity. The same thing. So when you come in with an illness and we start having a conversation and we start talking, then you figure out which is higher on the list that needs to be addressed, and if that would resolve the second one, or if you need to bring in a consult for the other concern.
Yeah. So that's spot on. That's spot on. To break down pretty much what she says is there are different factors you have to consider. First of all, is it if you have to rule out medical. If it's medical, you have to, check hormones, check labs to make sure everything is good. If everything is good, then we now go in depth, and then we hear from stories, because that's why it's always good for us as individuals to be open to our providers. Tell them the truth. Don't come and be cutting things, cutting, and be lying. and be removing something. I've seen it so many times. And it's you I want to help you.
I was always trying to ask that question. Say,
Yeah.
how do you discover the one that is lying?
Oh, you can always tell there
that is because some of them will say they want to fake so that they can get some a way out.
So again, it boils down to stigma.
And Max, so just like regarding tasks, right? Let me even be more succinct with the example. You come, let's say you're in a country right now, whatever part of the world you're in. Oh my God, I feel like I'm having a heart attack. My chest is racing and whatnot. You are going to go to the ER. To obviously they have to rule out if it's a cardiac concern. They are going to run your troponins. They're going to run your blood work and things like that. When everything comes back normal, everything comes back within limit and whatnot. That's like I said, they then have different consults and different, maybe it's a psychiatric consult or whatnot, and then start having that extra conversation. What were you doing before this happened? Why do you feel this way and whatnot? So that's where you're now going a little bit deeper into the concern and seeing, okay, your labs are fine. What are we missing? What is the root of your concern, of your problem?
Yeah. So last comment. Nobody should send another comment again today. Last comment. Dupe says we should be careful to use such statements like "from what we are hearing from Nigeria." Much of these hearings are, to say the least, exaggerations. Let's express our opinions in technical terms. Well, yes, and no, because we clearly know where we're from, and we have families where we're from. I understand what you're saying about hearing things from the outside point of view. I used to live in Jos, Plateau State, where they were fighting well. And what I'll be hearing people are saying when I'm inside wasn't as bad as what was happening inside. We know exaggerations do happen. But of course, when we talk as we must have done our research and, heard, had enough things to talk about before we come up to talk about them.
Smoke.
Yes, exactly. So yes, ladies and gentlemen, thank you very, very much for being on the show. We appreciate you. Aminat, thank you very, very much. You were awesome. Alice, thank you very, very much. You were awesome. Mr. Stanley, thank you very, very much, sir. You were awesome and wonderful. Sam Soft.
Yes, we do this like that.
Thank you very much. You were good. We'll talk about your outfit after the show. You have to pay taxes. You have to pay taxes, definitely. Well, ladies and gentlemen, it's been real. It's been wonderful. We'll say next week, please join us live in chat room as we talk about childhood trauma, the key to staying sane. Let's give it a motto. Sam Sop will tell you about how they flogged him.
And now all Nigerian children have experienced it.
And all those conk that they were conking us, the verbal. But guys, one thing
you want to touch on it now.
No, I just want to say this real briefly, okay? There's one thing I noticed that
topic,
is rampant. One of the major form of trauma for a lot of people growing up. Sorry, Dupe, I'm going to say this, especially in Africa, where I come from, because I know about where I come from. Is S assault. I don't want to say the full that word, SA.
Okay.
Yeah. That one uncle
come and visit.
Come and
commit heavy crime.
And the story is just rampant. So, guys, join us on Sunday. Yeah, join us on Sunday. We're going to talk about things like this because it's very, very important that we help each other. Okay, thank you very much for being on the show, Alice. Everybody, please don't forget to share this link to your loved ones and your family, even your enemies. Don't forget to share and help someone get better.
Yes.
Thank you very much.
Thank you, everyone.
Have a lovely evening.